Hi everyone, welcome to Belly Strong. Before we dive into the topic of sex, I just wanted to say from one pregnant mom to another that we would love to have you join our community. So hit the subscribe button down below to see when our workouts and other videos like this are out. A lot of women have questions surrounding sex during pregnancy, its safety, how often they can have it, and we'll cover a lot of topics today, the first of which is sex drive. So during the first trimester, many women don't want to be touched at all and cannot stand the thought of physical intimacy. And this is because of the nausea, stress, and fatigue in the first trimester, which can just mean you're not in the mood. Not everyone feels like this, and there is no perfect standard. During the second trimester, many women report an increase in sex drive, and we have hormones to thank for this. The breasts and the vulva become a lot more sensitive because of all of the extra blood flowing to these areas, and this can make sex a lot more enjoyable. Generally, during the second trimester, you'll find you have more energy, and this also translates to increased energy in the bedroom. Another thing that your body does is increase vaginal lubrication, making things wetter down there, which can lead to more pleasure in the bedroom. That being said, there's nothing wrong with you or your relationship if you find that you don't want to have sex. There are so many things that affect sex drive. If you struggle to conceive, or there's any trauma associated with a previous pregnancy or miscarriage, there can be a lot of anxiety surrounding sex, and you may find that you're more worried about hurting the baby and you're just not in the mood. Exhaustion and worry about growing size can also be a turn-off. Many women don't want to be touched if they don't feel good about themselves. But I'd encourage you to embrace all of the changes that come with pregnancy, and hopefully your partner is ready to embrace all of those changes with you without judgment. Many women wonder how much sex is safe. If you haven't been given a medical reason by a doctor as to why you cannot have sex, then you're free to have as much sex as you want, up to several times a day if you're in the mood. The baby is very well protected by the amniotic fluid, or the fluid in which they float, and very thick uterine walls. So it's pretty much impossible for your partner to end up poking the baby. What about orgasms? So although the uterus will contract during an orgasm, this is very different to the contractions of labor and will not lead to a premature birth in a low-risk pregnancy. So when should you not have sex? The first is if your doctor has told you not to. Although it's quite common to have spotting after sexual intercourse, there may be a little bit of a brown coloring in your underwear, this should be minimal and should resolve soon. If you find that you're bleeding more than that, or the blood is bright red, then stop and contact your doctor immediately. Other no-goes are if you have any unexplained cramps or bleeding, if you're leaking amniotic fluid, if you've had a previous history of miscarriage or preterm labor or premature birth, if you have a condition like placenta previa, where the placenta covers the cervical opening, or cervical incompetence, where the cervix starts to open early. If you have any of these conditions, your doctor should have already made you aware and given you advice on sex, so please listen to what they have to say. For some women, sex can be too painful to endure, and this can be caused by a few issues. One of these is varicose veins, or enlarged veins in the vaginal area, which can make sex very painful. This is also called pelvic congestion syndrome. You can have surgery on these veins after birth, but something that you can do during pregnancy is wear compression stockings to help with blood flow in the area. Problems with your pelvic floor, especially if the muscles are too tight, end up closing up the vagina, which can make sex very painful. The first thing I'd recommend is seeing a pelvic physiotherapist for an individual program. There are lots of things that you can do to help with the pain, including soft tissue release, relaxation exercises, using a dilator, and avoiding exercises that hurt. But different things work for different people, so I'd really recommend seeing a specialist for an individual assessment and treatment program. If sex is too painful or you just don't want it, there are plenty of other ways to get sexual release. Oral stimulation and fingers work really well, although something that I would recommend avoiding is blowing air into the vagina, because this can cause an air embolus or an air bubble, which can travel to the heart or the lungs, and this is very dangerous for the mom and the baby. Most sexual positions are okay as long as you're comfortable. Some positions that work really well during pregnancy, especially in the 3rd trimester when your belly gets a lot bigger, are doggy style, spooning where you're back to front, reverse spooning where you're facing your partner lying on your side with legs interlocked, using seated positions like sitting on a chair or counter, which give good access for using toys or oral stimulation, and reverse cowgirl where your partner is lying on their back and you are straddling them looking at their feet. Things to be aware of during sex are how deep your partner is penetrating, as it can be quite uncomfortable if they end up hitting the cervix, although this is not dangerous. Balance is affected during pregnancy for a lot of pregnant women, so I'd encourage you to choose positions that are more stable, like side lying instead of standing, to make sure that there's no risk of you falling over. Should you be using a condom? If you and your partner are STD free, then a condom isn't necessary and you definitely won't be getting pregnant again at this stage. A very thick cervical mucus plug protects against infection traveling up into the uterus. But if you have any transmittable diseases, please talk to your doctor to make sure that you're okay to have sex, and it might be a good idea to use a condom if you do. It's also really important to practice good hygiene and make sure to keep any toys that you use very clean to prevent any infection down there. So to wrap it up, if you have a low-risk pregnancy, sex is safe and you're free to enjoy it as much or as little as you want. If you have any specific questions or concerns, then I'd encourage you to discuss them with your midwife or doctor. It's also important to remember that you don't have to have an increased libido. There is no perfect standard, and there are plenty of other ways to foster intimacy. So if you haven't already, subscribe to our channel to see more videos like this. We'd love to have you, and I'll see you next time on another Belly Strong video.